Thank you. Thank you very much. Is this microphone okay? It seems very loud. Okay, thank you. I'm very happy to be here with you today, and I'm honored to end this really wonderful forum. I'm just curious, before we get started, how many patients are on warfarin currently? Okay, how many are on the newer anticoagulants? Okay, 1, 2, okay. And how many are here just as support? Great, excellent. So a lot of these tips that I'll be discussing actually do revolve around warfarin, and many of you have been on these agents for several years, so you can potentially share your tips with me as well. I am happy, though, I will try to address some of the newer agents, and am open to answering questions as well. So when I counsel a patient when they first start a blood thinner, I usually say, try to make them feel a little bit better that these agents, as you know, are extremely common. We can see that over 2 million people take blood thinners every day. However, the caveat is that these agents are amongst the most complicated medications that you could be on. However, they can be very safe and easy to take. So again, I'm going to highlight some challenges, some tips potentially, and I would love to hear your tips as well. So you get that prescription initially. It could be for, as we know, some of the injectable anticoagulants, or I've listed the oral agents there, including the new drugs, dabigatran, rivaroxaban, and apixaban, as well as their brand names. After receiving that prescription, there may be a sense of panic and a lot of questions. So some of the themes that I've heard here this morning are to ask questions, and this is my number one tip, is to ask questions. My husband often gets annoyed with me because I ask a lot of questions, but in this particular case, you have to, and you have to be your own advocate. As one of the patients said, if you can't be your own advocate, have somebody who can do that for you. So I've been educating on the anticoagulants for about 8 years. But for the first time, actually this past January, my mother was diagnosed with a pulmonary embolism. So it sort of became a little bit close to home. She was discharged from a very small rural hospital in New York. There was absolutely no discussion about selection or choice of agent. Really to the point where I got on the telephone for her with her primary care doctor and tried to have that conversation, pros and cons of warfarin compared to one of the newer agents. And then she actually received no education whatsoever when leaving the hospital, which I was astonished by. But so I sort of did my part, and of course, being my mother, I educated her and gave her the tools that she could be her own advocate when dealing with her healthcare providers. So be proactive. Education is key. Try to educate yourself, your loved ones, your family, friends. And I put this quote here that nothing shapes our journey through life so much as the questions we ask. It's vital. There are going to be some challenges, which I know a lot of you have probably already faced with these new agents. And I wanted to prepare you for some of them. And I think there's sort of 3 areas where you will face challenges in terms of taking your medications. One will be initially with your healthcare provider. The second will be in the pharmacy, and then your third will be at home. So questions are going to come to your mind. You get this prescription. You're being told you have to be on a blood thinner. You're thinking, am I going to bleed? What do I do if bleeding occurs? Where should I expect to see bleeding? When should I call my healthcare provider? And these are all questions that you should ask your healthcare provider, regardless of who it is, when you are getting that prescription for a new blood thinner medication or a change in blood thinner. In terms of risks of bleeding, there is serious bleeding, which is when you're going to the bathroom, you notice any blood, vomiting blood. If you fall, that is a risk of having serious bleed. And then there's something called nuisance bleeding, which you may be familiar with. Some tips to avoid bleeding. Serious bleeding would be to be cautious with your high-risk activities. If you're involved with sports, mentioned, when you're driving, carefully driving, trying to just be cautious of any high-risk activities. Maybe I've had patients who played football, riding motorcycles, things like that, high-risk activities, you do want to be careful. Wearing proper safety gear, depending what you do for your profession, or even if you're just working outside on the house with power tools, being cautious again and providing a proper safety gear. When you're inside, wearing shoes or non-skid slippers is potentially a helpful tip to try to avoid falls. And then nuisance bleeding is more of minor bleeding. As you know, if you cut yourself, we already talked about shaving, it will take a little bit longer to bleed. Wearing protective gloves when you're working with tools, being careful when you're working with knives, scissors, razors. Be careful trimming your hair and nails. Again, if you sort of nick yourself, it may take a little bit longer to stop bleeding. Using a soft toothbrush, your gums may bleed a little bit more. Being careful when you floss. Avoiding toothpicks where you may jab your gum. Wearing shoes outside to avoid cuts on feet. And then, of course, appropriate monitoring. So one of the big things about routine, if you're on warfarin, which majority of you are, routine INR monitoring is to ensure that we keep you within that target range, and that will also help avoid bleeding. Another challenge will be this monitoring that you hear about. Again, this only pertains to the warfarin people. What is an INR? Why do I need INR monitoring? How often and what can affect INR? These are all questions that you may have in your mind that, again, should be answered. As many of you know, INR target is individualized, as we've heard. Some patients may have a higher range than others. It will be determined by your healthcare provider. In general, if your INR is below your target range, you are at increased risk of clotting. If your INR is above your target range, you're at an increased risk of bleeding. Each person will require a different dose to achieve the same blood thinning effect. So I think this is important that, one patient may be on 1 milligram a day and another patient may be on 15 milligrams a day. So whatever dose is required to get you to that target range. I know, using my mother as an example, she started at 5 milligrams, she titrated up to 10 milligrams, which is very common, but she felt like 10 milligrams was very high and her friend was only taking 2.5 milligrams. So trying to make her feel better that it's really very patient specific, and our job as healthcare providers and whoever's managing your warfarin therapy is to find the dose that's right for you. And again, testing frequency will be based on the stability of your INR results. If you're stable, it could be once a month. We've heard some patients get their INR test 1 to 2 times a week. There is some data that if you are stable, we can extend beyond that once a month testing. And there's also patient self-testing, which can be very convenient as well.